Pennsylvania, Drexel, and University of Cincinnati, and you've always kept adding and growing. You're not one of those doctors that stagnates and just stays in one, modality.
Gosh, no.
And so,
I would be so bored if I was just doing one thing. I did 2 years of orthopedic surgery as a resident out of medical school. That fascinated me, but I wanted more to life than orthopedic surgery had provided me at that time. I was curious about so many things. So I have learned about craniosacral therapy. I told you I've learned about healing touch. I explored diet and nutrition, and there were many mentors. There was a woman who came to my house. My wife says, there's a physical therapist you need to meet. I've invited her over for dinner. And she came over for dinner and she said, your skull bones move. I said, no, they fused when I was 2 years old. And that conversation went back and forth because I was still in this position where medical school told me your skull bones fuse. And as soon as her head hit my hands, I realized it wasn't my hands moving. And from there I went to, oh my God, what else did I learn that I thought was true that turns out to be wrong? And I went on this explorative quest to learn more, not taking anything for granted that I'd ever learned before. And through that process, I've learned to keep the things that work, to keep the things that are good. I use medications. I use the things I was taught in school. I use the things I learned in my orthopedic 2 years of residency every single day. But I've explored so much more that took me from orthopedic surgery to the presidency of the American Holistic Medical Association and all the other things that I've learned through the years.
Right. It's just to me so amazing because many of the things that you have talked about, I have had the opportunity to experience and actually even had people on the show that do some of these things. I'm curious that finding your niche is a reoccurring thing. There's like new niches. But earlier you talked about some of the places you were, but I also found it fascinating that you, early in your practice, did family medicine for some time, and then you ran urgent care facilities. So when you bring all these things from the different modalities, I wanted to know what lessons or stepping stones were found in those arenas that may have informed or support and led you to some of the work you're doing now. Did you see like recurring things there?
I learned a lot of things that didn't work. I learned a lot of things that couldn't help people. I learned that there were so many people in pain that what we were taught when we went to school didn't work for. When we see people in pain, the predominant view around the world is you have an acute injury that leads to acute pain, and then if that pain doesn't go away, some magic happens between 3 and 6 months that acute pain turns into chronic pain, and then we're taught you can never make it go away. You have to injure or interrupt the signal from the nerve, either with medication or surgery or cryotherapy or something, but you're taught that it doesn't go away once it lasts 6 months. And that didn't make sense to me. It just didn't, I didn't find
it
flavor
wasn't
in
germane.
that. And what we found through our work is that some of it's true. Acute injury does lead to acute pain. But the next step, there's no magic between acute and chronic. If the body will continue to experience that pain or some version of that pain until the injuries that caused it are healed and go away. And so we've learned how do you find the injury, how do you figure out where it is, and then how do you help this person's body heal and restore so that injury can heal and then that pain can be so much better. And it works for so many people that the other things we were taught don't work for.